So we're about a week out
So,
from the anniversary for schools, and that's really kind of your wheelhouse. What have you seen this past year be like for children, the children that you help through Nationwide?
absolutely. When we first heard schools were going to be closed, we were like everybody else. It's a surprise. What is this COVID? But the first thing we did, Nationwide Children's Hospital did right away is equip all of our clinicians in the entire school-based program with the HIPAA compliant telehealth equipments. And so we were able to provide telehealth services from clinicians' home. And we were able to see kids as we did before. Obviously, with some of the students, they didn't have access to Wi-Fi, but the schools were able to recognize that right away, and they were able to remedy that. And I could give you an examples of how some schools were able to jump right on and support us. So one of the things Bexley City Schools did was that in the summer, any kids that we were seeing, they made sure they kept all their technology tools so we could continue to provide them telehealth services. Reynoldsburg City School was able to send buses out with Wi-Fi equipment to neighborhoods where areas didn't have the access to Wi-Fi. And so the Columbus City School. So all the schools were able to jump, including Canal Winchester, to make sure that we were able to have access and see children.
It seems like you cover such a wide variety of schools. You know, you've got your suburban schools outside the outer belt, a little bit rural, even in Canal. Then you've got your true city schools like Columbus, and some because Bexley is so walkable, considered that as well. Um, I think it kind of shows you, and perhaps I'm assuming, I think it just kind of shows you that this pandemic, no matter where the kids were, it had a very similar effect on them.
Absolutely, absolutely. And when you think of mental health, it's inclusive of all ages. But the children, we notice right away, they're the most vulnerable due to their limited understanding of the pandemic. There were a lot of fears, and this was somewhat of a new normal to them. So, social distancing and seeing everyone wearing a mask can create more fear for those children. And, with their coping skills is not like adults where we would have more coping skills.
Can you talk about the different, I guess, perhaps stages the kids went through? I'm sure they might have been scared at first, and then angry, and then just kind of bored, maybe lashing out. Can you talk about the plethora of emotions and just different types of mental health issues that the kids could have gone through during the past year, and what you guys did to help remedy that?
Yeah, as we know, children are continually developing and learning. And so, in the beginning, it's almost confusion as what is going on. And they learn by watching adults around them. And one of the things that was removed from them was school, which is mean teachers and just the lunch people and anyone that they see in the school was removed. And so, the lack of the structure, the peer interaction, if it's lunchtime, and just the basic routine and socialization greatly impacted their mental health. We've noticed just young children with just living with the daily stress of parents. They had to learn to be independent in new ways, which could be positive in some areas, but it became a point of tension. Kids weren't sleeping well, they weren't eating well, they weren't able to go outside and play, and the increased symptoms of anxiety, depression, and oppositional behavior was showing up. And oppositional behavior is not necessarily because they're oppositional. It could be ways where kids just show their symptoms because they don't have words to express themselves. So kids could be argumentative, refusing to do their schoolwork. But the other concerning areas that we noticed is aside from the regression is that children were saying, I don't want to be in this world anymore. I don't want to have it. I don't have friends. No one likes me. And things that they used to do that was easy, even when we're meeting with them during sessions, things that were easy and they liked, they didn't want to do it anymore. They felt like they couldn't do it. And these are the things we pay attention to and that we ask parents to pay attention to, things that they used to do, their sleep pattern and eating pattern and habits and how much they have changed. Especially when they say, no one likes me and I don't want to be in this world anymore. Obviously, that's pretty serious.
I feel like that's something no parent wants to hear. Um,
Absolutely. Absolutely.
if that were to happen, what should the parents do? How can they get some help, I guess, beyond what the school system provides? Because with your teacher, I feel like a lot of the times at the first line of defense, they spend so much time with their kids, and now all of a sudden they're through a screen, and it's really hard to gauge people's emotions. How did you guys bridge that gap? Not having those teachers there to really keep an eye on the health and well-being of the students when perhaps they were in some stressful situations.
Absolutely. So one of the things we wanted to do was, aside from providing support to the kids, which I'll get into in a little bit, was really focus on how we can provide support to the teachers. Because as teachers were able to change their schedule and provide services for kids through Zoom and home, they were seeing things they weren't used to seeing, or parents would jump on and say things to them that also, while they were doing the teaching, they were also going through their own stress. So we wanted right away to provide support to the teachers, and then also equip them with how to provide resources and support to parents. So some of the things we tell parents to do is talk to your children. Just normalize in your own home what's been going on. You don't have to hide it, or you don't have to, make it more scarier, but just talk about it, because as I said earlier, children don't have the coping skills that we as adults have, and just talk to them about how sometimes you have to cope, how this is different and it's not always great. Ask them about their feelings and validate their feelings. Create some simple activities you can do in your home, because not everybody has access to a sidewalk or playgrounds. Not every kid could go to sports activities or dance. But if you could sit on a living room with your child on a day and just talk to them, and if you could draw pictures together, or as busy as they are as parents looking at whatever basic needs that they need, and they have their own stresses, make it okay to talk to your child and let them talk to you. Give that space for them to validate their feelings.
So we're seeing some big light here at the end of the tunnel. Governor DeWine said, I think it was a few days ago, that 95% of our kids are back in the classroom in some way. Our teachers are becoming vaccinated. Many of them have already received their second dose of the vaccine, and they're fully vaccinated at this point. How crucial is this transition back into the classroom, and what does this mean for kids who may have been struggling over the past year?
So we are also excited to have kids in the classroom. All of my clinicians are excited to see kids again, because that's what we got into this field for, is to have that connection. And then for children to not just through a screen connect with a teacher, we have, as you know, the model before was for some of the schools that were open, you had group A and group B. A lot of times group A did not know who group B were, and they didn't interact. Some of them knew each other, but they didn't interact. So going back is almost like the first day of school. It's not just starting halfway, it's going the first day back at school. And one of the things we wanted to do as Nationwide Children's Hospital School Base is really go into the school and provide support to these kids. The new way of socialization, what does that look like? A new way of sharing your teacher, it's not group A, group B, it's sharing that teacher, and what does that look like? And then understanding space and lunch, and because some of them have fear, and some fear is okay. So we want to normalize that. Some fear, some anxiety and concerns are okay, but how do you ask for help and find that support?
That's right.
So we're so excited.
Oh, sorry. Go ahead.
No, I was gonna say, we're so excited kids are coming back and we're able to work with them.
Especially for older kids, maybe probably like 10 and up, who truly understand what the coronavirus is and that it's a little bit dangerous. That might be a source of anxiety. As far as getting sick, no kid wants to be sick or get their parents sick or their grandparents sick. How should parents and teachers talk to their kids about reassuring them that, you know, they themselves are going to be okay?
Yeah, the first thing I think they would do is exactly what you said. Talk to them. Just talk to them about what they're feeling. And kids have access. So I cover elementary school, middle school, and high school, the whole from 5-year-old all the way till they finish school. And so one of the things we do is make it okay to talk about it. If they have fear, if somebody doesn't have the mask all the way on, or they're afraid they're going to hurt their grandparents, talk about it. But then tell them, or you could even go to the CDC and read what safety look like, and then following each school rule. Each school, is a little different as far as what PPE protocol they want to follow. But look that over, talk to them about it. You could even role play at home if you want to. Like if somebody at lunchroom put their mask down, how do you say to them, put it back up, or go talk to a teacher? It's almost like, how do you find support in the environment you're in? But the first thing to do is talk to them about it and normalize that some fear is okay. Don't be scared of it, but come, let your kids know that they could come talk to you. If not, they could talk to the school counselors. The school staff is also always able to talk to them.
Um, do you foresee any long-term effects of kids being out of school, and or their activities, their sports, their band, orchestra, etc.? Do you foresee any long-term issues for some children? And what are some signs that parents and teachers can look for to help mitigate that so they don't take this into adulthood?
That's a great question, and that's actually something that we do think about. Obviously, I don't have the whole answer of what would happen long term, but we are paying attention to kids who really struggle to adjust even when school opens back up. That again, the small tasks they used to enjoy, they don't enjoy it. Even as parents work with them and time has gone by, they still struggle with that, and they still feel like no one likes them. They don't want to be in this world. Those are the things that concerns me. As far as the long term, it's really about connection that they have with either family members or school staff or even some peers. If they still don't want that and they self-isolate, those are the concerns that we have as we continue with this pandemic.
What what's I guess, we're still trying to, as much as we can. It'll start opening up soon, but stay in the bubble. I guess, I feel like isolation has become a part of a lot of our lives at this point. How do you, I guess, tell the difference between a child who is self isolating versus like what your family is doing, on a normal basis? Maybe they need some time away in their bedroom. I guess, what's the
Yeah.
difference, I suppose?
Yeah, absolutely. How long they're in the room, how long, when it's, if family have routine, obviously the routines have changed. This is why I encourage family to create a new routine in the home, whatever values they have, whatever their cultural background, create a routine. But if that child, teenager, still continues to fight against the routine, is not coming out to eat with anybody, it's not even coming out of the room for 10, 20 minutes, watching a show or just anything interaction with just one parent or a grandparent or one relative, that's a serious concern. If they're in their room all day, all the time, if they're not bathing, taking care of themselves, the basic needs are not being taken care of, it's a concern that parents need to be aware of.
Okay. Just, I guess, one last question. How important is it at this moment right now, or how good of a thing is it that kids are finally getting back into the classroom?
It's wonderful. Obviously the pandemic, it didn't impact every children the same way. Some kids are introverts. They like being alone and not having to interact with anyone. But for majority of kids, it's not even just going into the classroom and learning with the teacher. It's just going outside to play. Is watching others, because some kids learn by watching others and that whole role modeling and just interaction and walking in the hallway and having somebody, kids who really struggle academically, to have somebody there that could guide them and educate them. And then having that structure, again, going back to that routine structure is so crucial to the child's well-being. Even a teenager who may say, I don't like school, I don't want to go back to school. But going into the school building and seeing their peers maybe doing more schoolwork will encourage them. A teacher who looks at their schoolwork and actually is there to speak to them about it will make a big deal, just as far as how far they can move in their academics and their social well-being.
Okay, finally, let's talk about the Behavioral Health Pavilion. That 1 year anniversary of this great resource
Yes.
that we have here in Central Ohio, really kind of a one of a kind thing, is corresponding exactly with the 1 year of the pandemic when we've seen a greater need for it than ever. Um, how has that helped? And can you talk about the type of resource this has been for our community during this time for our kids?
Absolutely. I was honored when I started the Nationwide Children's Hospital to give a tour for others at the pavilion. So I was able to walk in and out of there and got to know all the resources we have for others. We are so glad we do have a model of care during this pandemic to give kids the help they want. Mental health obviously is a crisis in a pandemic from before all this, but to have this building visually to look at, and overall the pavilion has seen an increase in cases. But for me to hear that school staff and parents saying that they could send their kids into an environment where they know they're going to be supported, the resources is there for them. And then they're able to leave that environment and be able to connect it with their community resources. It's just been outstanding. And I am so happy that Pavilion was there to provide support for all those families.
All right. And for our Central Ohio families who think that their kid might need a little bit of extra help, where do they go? How can they turn? What are their first steps? Who do they get in touch with?
I love that question. So there are lots of resources out there on oursleeves.com. That's ONOURSLEEVES.org for families. Obviously, they could always reach out to their school staff. But if you go to our website, on oursleeves.org has tons of resources for families.
Thank you so much. I really appreciate you taking the time to talk to me today. Is there anything I didn't ask that you would like to touch on?
Just to let families know that they don't have to be alone in this, that we're all in it together. We're here to support them in every possible way and to not feel like they're bad parents or something they're not doing right, but to be able to reach out, just to reach out and know that there's help out there.